This information is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations. Remember to follow instructions for use for the product you are using.
Peristeen Plus is a transanal irrigation system that helps people manage fecal incontinence and/or constipation. It is designed to help those who cannot get sufficient relief from conservative treatments, such as diet, laxatives, or lifestyle changes. Peristeen Plus is an effective, water-based treatment. It is vital for patient safety that they consult a healthcare professional trained in the use of Peristeen Plus Transanal Irrigation before performing the irrigation procedure for the first time. Peristeen Plus enables users to decide when and where to empty their bowels. It assists the evacuation of feces by introducing water into the bowel via a balloon catheter through the anus. Peristeen Plus is designed to prevent fecal incontinence and constipation for up to 2 days. This will help your patients to regain the control and the confidence they need to take care of the important things in life, such as work, school, and spending time with family and friends. With over 25 studies highlighting its benefits, the original Peristeen system with balloon catheter was the first and most widely documented manual transanal irrigation system on the market. Building on the evidence-based legacy of Peristeen, the upgraded Peristeen Plus is equivalent in efficacy and function and is easier to use. When first starting to use transanal irrigation, it may take some time for the bowel to adapt to the new treatment. Therefore, everyone needs the right product and lifestyle support along the way. And that's exactly what your patients will get with our patient support program, Coloplast Care. The combination of a proven product and the right support can help make a long-lasting difference to your patient's bowel management routine. Information from Coloplast Care is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations. You should rely on the healthcare professional who knows your individual history for personal medical advice and diagnosis.